Hi everyone. I'm Advika Anand, and I'm originally from Jackson, Mississippi, but I'm currently a rising sophomore at Duke University. Today I'm going to be talking to Dr. Emily Birenbaum about hormonal birth control, and this is something I've been thinking a lot about recently, especially after Roe was overturned, and as a woman, there's a renewed interest in our reproductive health and the steps that we can take to keep ourselves and our bodies safe. And of course, hormonal birth control is at the forefront of this list, but we don't always know what comes along with all of that, and how that may affect our bodies. So that's why I'm really excited to be speaking to Dr. Emily Birenbaum and getting these questions cleared up so that we can all be in the right positions to make the best choices for our bodies. Welcome.
Thank you for having me. I'm excited to be here and I'm really looking forward to our conversation. And you said it all well in your introduction. I can appreciate the fact that there are a lot of concerns, and I'm happy to answer any questions that you have.
Yeah, thank you so much. Now, just a little bit about Dr. Birenbaum. She is the medical director and the head of women's health here at Caraway. She's also an OBGYN, so I really can't think of anyone better to get our questions cleared up by. So if that's good with you, we're going to go ahead and get started.
Yeah, sure. Shoot.
So, like the first thing that comes to my mind when I think about hormonal birth control, just through so many conversations that I've had, with my mom, with friends, is the side effects. Everybody describes, this varying array of side effects that they face, whether that's mood swings, weight gain, or acne. And that's made me quite afraid to take hormonal birth control myself, not to mention again, we're growing up in an age with a lot of social media where I have seen like clips on TikTok, for example, that show, oh, this was me before I took birth control, and this is how I look now. Therefore, you should not get on hormonal birth control. And I'm
Mhm.
just not sure like how accurate this depiction of side effects is. Is it exaggerated? What's the real deal with it? And I was wondering if you could clarify that.
Sure. Totally appreciate all of those concerns. I would have them myself. I just want to address really quickly right off the bat this business about TikTok and what you've seen on TikTok. And we just want to make sure that everyone is aware of their algorithm. So, like, if you see one video that depicts one perspective, you're going to get fed many more videos with the same bend on it. So, like, if you somehow got a TikTok video that was talking about how, happy this person is to be on hormonal birth control and look at my body before and after, and it was all positive, maybe you'd see more of those. But if you see one negative TikTok video about, birth control pills or an IUD, you're going to see a lot of negative content. So just bear that in mind that you're not exactly getting a balanced assortment of videos from TikTok
Right.
users. So that's kind of tricky on their part to do that. But anyway,
Right.
the other thing that I always try to stress to people before they get started on something and they have concerns about, what if it's awful or what if, I'm crying all the time. I mean, then then you stop it. This is not a forever choice, and these aren't irreparable changes that you go through. So because I don't want to discount anyone's negative experience because everyone has their own experience. And some people are very happy with the choice they opt for, if that's birth control pills. Let's just use that as an example because that's the most common form of hormonal contraception out there. So somebody may opt for birth control pills and be really happy with it, and other people may opt for birth control pills and um, experience weight gain. And even though the data says that weight gain is not associated with birth control pills, I've talked to enough young women who say that's absolutely not true. So I believe patients when they tell me a negative side effect from a contraceptive option. But what I want to make sure that everybody understands is if you choose something, it's a trial. It's not a forever choice. Okay. Um, so back to your question, specifically about mood changes and weight gain, because those are the two big ones. Um, and there really isn't any scientific data, and believe me, I have combed through it looking for verification of weight gain associated with pill use, and there really isn't. There's
Mhm.
definitely associated weight gain or weight gain associated with the Depo-Provera, which is the injection, um, and a little bit less so, but also some with Nexplanon on the implant in the arm, on average, like 6 pounds. But I have people who swear that when they went on birth control pills, they gained 20 pounds. I don't not believe them. Um, but that's not the case for everyone. So I encourage people to try it because you can always stop it. And regarding mood, again, we usually say, oh, whatever, whatever the complaint is, if it's some people complain of breast tenderness or nausea, and we say, well, give it just a few weeks, a good 6 weeks, and see if those symptoms don't go away. But with something like mood changes, I would not encourage anyone to stay on it for as long as 6 weeks. We can stop it right away, and then you go back to the way you were before you tried it. Um, and you also mentioned acne, but there's acne is actually an indication to use birth control pills because it really
Um,
does help treat acne. In fact, I've spoken to a lot of dermatologists who always feel badly for their male patients because they can't put their male patients on birth control pills. So it's a treatment for acne. Does that answer your question?
Yes, for sure. And I think your answers really elucidate how much misinformation is out there, exacerbated by the spread of social media because we take one experience and we assume that that's everyone's experience. And as you emphasized, everybody's individual experience can look very different. And I also really appreciate that you said it's not a permanent choice, right? I think sometimes we feel very locked in to the decisions we make about our bodies, but that's
Yeah.
not necessarily the case. And I
Well,
really appreciate.
yeah, I mean, because also don't we all want that? Don't you want to be like, oh, okay, let me decide on this and then move forward with it. I mean, nobody likes to go back and forth and like throw spaghetti on the wall and see what sticks. Like everybody's like,
Right,
oh, can this just be easier? And sometimes for some women, it really is easy. I choose a pill, they go on it, they're happy for years. But for other people, it's not so simple. Like they try a pill and they're like, "Oh my gosh, this is not working out." So I always at Caraway we've decided, our protocol is to start somebody on a new method and then have an appointment in 3 or 4 weeks to follow up and see how it's going. It's so easy to leave a doctor's office with a prescription and then feel sort of abandoned, or trying and then have trouble getting back to the doctor to say, this isn't working right. So I don't want anyone to just give up quickly because we can help troubleshoot any issues that you might have when you start something because for some people it isn't so easy to get it started. But there are a lot of people who do get lucky and just try something and like, oh my God, this is life changing. I love it. I'm never
right.
going off, you know. But so we're here to help troubleshoot.
I had one more follow-up question to my question about hormonal birth control and the side effects. Due to these side effects, there's a lot of questions, and again, misinformation, information out there about natural options for birth control. And I wanted to see what you had to say about that.
Um, when you say natural options, um, what do you mean by that? If I can ask you your question back, I want to make sure I understand.
Yeah, sure, of course. I think I would perceive that to mean something that's not hormonal, something that wouldn't really a different type of birth control that wouldn't necessarily affect the other aspects of my body, or like wouldn't affect my mood, or wouldn't have any kind of other side effects on my body.
Okay. Um, that's sort of a tough one because, you know, natural sounds great no matter what it is. But I don't really, you know, I don't know, other than using what's called the rhythm method, you know, where you track your cycle and anticipate when you ovulate and avoid having intercourse during that window of ovulation. I don't really know what it means to be on natural birth control. Like, there's hormonal birth control, the pill, the patch, the ring, Depo-Provera injection. There's the long-acting reversible contraceptions, some of which have hormones in them, like the implant in the arm, the hormonal IUD, and then the copper IUD. Um, so, and then there are condoms, right? Both male condoms and female condoms. Um, Cervical caps, which are really not very popular these days, and diaphragms, and spermicidal gels and creams. So when you say natural, I never really know exactly what that means. So to hear you say, oh, well, it won't affect my body, it won't affect my cycle, um, I would say that condoms are really the only thing that wouldn't necessarily um, have a direct effect on your body. But that effect, I also want to stress, is often positive, like you don't get pregnant. Um, so,
Right.
um,
Right.
you know, so is there a natural birth control? Well, there's abstinence, there's the rhythm method, which is hard to use because um, it's hard to know exactly every single solitary month, exactly when
Right.
you're going to ovulate. So, you know, some months you have a 28-day cycle, and the next month, maybe your cycle is 32 days long. And what that means is that you're ovulating at different times. And it's impossible to predict exactly when you will ovulate. So, when do you know when to avoid intercourse? You don't. You can only,
Right.
from the first day of your period, count back and know when you did ovulate. So, while I um, appreciate everyone's quest for natural contraception. Um, I don't think we I don't know what that would be.
Yeah.
Not
I think
satisfactory, but you know,
No, I completely understand, and I think the elucidation you offered at the beginning about how these side effects aren't necessarily as devastating as we may perceive them to be, and that they're highly variable from person to person, and it's no guarantee um, that you get on birth control and you will experience them, and that getting on birth control is a reversible action, sort of eliminates really the need to pursue more natural methods that aren't necessarily as safe. And that's the best thing, right? Like to be
right,
to be safe.
right, or not as effective is a better word, right? Because
Right.
you know, abstinence is safe and very effective, not exactly practical. Um, and you know, I don't want to be disingenuous by saying that there are no side effects to birth control pills. I think I made it clear that, you know, I absolutely 100% believe anyone who says, I went on birth control pills and I gained weight, or I went on birth control pills and my mood was just really, you know, wacky, and I was really anxious and I cried a lot. I believe somebody who says that. But you know, that is not everyone's experience. But so while I'm sitting here debunking some of the bad rap that hormonal birth control options um, have, I want to also be clear that there are side effects. that are
Right.
very real, and that need to be addressed. And that's when taking someone's personal medical history is really important. If you are somebody who suffers from migraines and you get a really bad aura, like visual disturbances, you are not a candidate for hormonal contraception. If you have a personal history of developing an abnormal blood clot, usually that happens like in the lower leg, you are not a candidate for hormonal birth control. You're a great candidate for the copper IUD if you want something reliable. And there are progesterone contraceptives that are safe for people who have a history of clotting. So there are reasons. They are not for everyone, not just because of personal choice, but also medical reasons too. So I don't want to make it sound like, oh, all of your concerns about weight gain and acne and mood changes are not worth not trying it out. There are reasons to avoid hormonal contraception. And that's when it's important to have a conversation with your doctor about your own personal medical history so we can make sure that you're choosing a safe and effective option for you.
Yeah, and I think that perfectly sort of captures what we were discussing earlier is that everybody is different and what works for one person might not work for another and the side effects look different from person to person. So important to emphasize that. That kind of leads directly into my next question. You brought up the copper IUD, I think the arm implant. And so obviously there are so many options out there when it comes to birth control and hormonal birth control. And I don't know that I exactly know the difference between the various types. And so I was wondering whether you could elucidate the difference between the most common types, such as the pill and IUD and Nexplanon. And are certain types a better fit for certain people? How can I know what's best for me? How is that determined?
Okay. Gosh, I'm gonna have a hard time being quiet. I love talking about this. So, what works best for you is really speaks to, like what's going to work best for you day to day life. Like, are you somebody who maybe you already take medication on a daily basis, and so taking one other pill is no big deal. Like, so that's easy for you to remember. Or if you're somebody who doesn't ever take any medication, it might be a big ask for you to put into your routine every single day to remember to take a pill. So people who aren't so great at this routinized thing, like take a pill every day, maybe birth control pills aren't the best option for for that person. Um, so that's the thing. The pill doesn't work like a condom, like as needed. The pill works because you take it every day, not just because, oh, I'm going to have sex tonight, I'll take a pill tonight. It doesn't work that way. So if you have trouble remembering, if you think you might have trouble remembering to take a pill every day, the pill is not the best option for you. Um, but the pill has both estrogen and progesterone in it. We have progesterone only pills. Also, um, I know you didn't ask me about the patch and the ring, but I'm just going to throw that out there that the
Please go ahead.
okay, so the combination birth control pill, there's the combination patch and the ring. So the pill you have to take every day, the patch you put on once a week, and the ring goes in the vagina once a month. So you get, they have very similar side effect profiles and similar benefits. So it's
Mhm.
just daily, weekly, monthly for that. Um, uh, so I think that covers that issue. Oh, and then there are some people who have medical reasons and they shouldn't be on estrogen, but
Mhm.
progesterone, which is the other dominant female hormone, um, is in the implant in the arm and in the injection that people get and in an IUD. So there are some people for whom estrogen is not a safe component, but progesterone alone is okay. So um, the implant that goes in the arm can be in there for 3 years. So
Mm.
you do have to be seen in a doctor's office to get it placed. Um, so that is a drawback for some people, but once you get it in, you've got it for 3 years. And again, even though it's a, it can stay in for 3 years, it doesn't have to stay in for 3 years. If you get an Nexplanon placed in your arm and a month later you decide, I don't like this, I don't want this, for whatever reason, you can get it taken out. So again, even these long-acting contraceptives are also truly reversible. So nothing is a lifetime commitment.
I think I think there is a prevalent tendency to assume all women's bodies work the same way, because all women have hormones and we all have, these ups and downs in our cycles. And so I think there can be a tendency to assume just because this works for that person, it should also work for me because we're both women. And like you've shown, that is just not true. Um, so that is I think such an excellent point that you made. And speaking of an IUD, I've heard a lot of horror stories related to IUD insertions, whether that's through conversations with friends about how incredibly painful it was, or I even
Mhm.
saw a conversation about someone saying that, oh, anesthesia should be offered for IUD insertion. It is offered. This is why it's offered, is because it's so incredibly painful. And these experiences, like I said, all suggest that it's extremely painful. And personally, that would scare me away from getting an
Mhm.
IUD. And so I just wanted to clarify, how painful is it really to get an IUD? Because I know the truth can become a little distorted when it's passed through stories. And is there anything that we can do to make it less painful?
Sure. Um, so in the way that somebody may be really happy on a certain birth control pill and another person would tell you, oh my gosh, I went on it and I couldn't stop crying. I was so happy to get off of it. Same thing with discomfort getting an IUD. Um, there are a lot of people, absolutely, who say that was crazy painful, but there are just as many people who say, "Oh, it wasn't that bad." So if you hear one bad IUD insertion story, you haven't heard every story. They're just like people have different, likes and dislikes, and some people, have higher pain thresholds, and other people say, "Well, I have a high pain threshold, but somehow that didn't really bother me." Like it really is different. It's unique, person to person. How uncomfortable or how tolerable is it? So, I always tell people though, before they're coming to get if they're coming to me for an IUD, I always tell people a couple of things. First of all, it's really recommended to take Advil or ibuprofen, Aleve ahead of time. So, literally 1 hour before your appointment, you should take a pain reliever, like
Mhm.
Advil, Aleve, ibuprofen. That really absolutely works. And I don't mean just, 2 tablets, take three. So 600 milligrams of ibuprofen 1 hour prior to insertion goes a long way at making it more tolerable. Another thing is that um, people are sort of uncomfortable with this idea, but if you can time it, if you have the luxury of time, schedule that appointment, excuse me, for when you are on your period. The cervix is a little bit more forgiving when you're bleeding. So, oftentimes the insertion can go a little bit easier when you're actually actively on your period. It's also a great way
Mm.
to know you're not pregnant when you're on your period. So you can, time it so that you're on your period, you've taken ibuprofen ahead of time, and you can also ask the doctor to use a local numbing medicine. So it's not anesthesia like go to sleep anesthesia, but it is numbing medicine that we put locally around the cervix, and that really does help too. The last thing is bringing with you a heating pad or a hot water bottle. And sometimes just having that heaviness and that warmth on your lower abdomen during the procedure also goes a long way to make it more comfortable. And I think I said that was the last thing, but this is really the last thing. And that's to make sure that you communicate to the person who's placing the IUD what your preference is in terms of, do you want to know step by step what's happening? Will that help you? Will that anticipatory information help you relax more? And you know what's going on, so there are no surprises. Or are you somebody who says, I'm going to put headphones in, I'm going to listen to my, you know, favorite heavy metal album so that I don't have to hear anything that you're saying. You can make those requests of your doctor. Say, like, I want to know everything that you're doing before you do it, or I want to know absolutely nothing. I'm going to just check out and listen to my music. You do what you need to do. So you have to, you know, speak up and say, I think it'll make me um, more comfortable if you're very clear about what you're doing before you do it.
Yeah. And I think, this list of things that you offered is fairly simple. I mean, it's not like, a water bottle or like a hot water bottle or taking ibuprofen or Advil is something we do. So I do it so often on my menstrual cycle just to deal with, cramp. So it's not like those steps are very extreme. And so I think I'm sure that will help a lot of people, I think, get over sort of the fear of pain that comes with IUD insertion. And so that's extremely helpful. Thank you.
Sure. And one more thing, like I think that
Yeah,
if somebody goes for an IUD insertion and it's a terrible experience and it doesn't, they end up leaving without it because they couldn't tolerate it. If any of those pieces that I suggested were missing, try again. Like, you may find that the addition of Advil or the addition of the provider using a local numbing medicine is helpful. And, even um, sometimes giving somebody, a very small dose of an anti-anxiety medicine ahead of time can be useful too. But that's a conversation, to be had with your doctor ahead of time. If there's anything that can be prescribed ahead of time to make it easier.
yeah. Well, thank you. And I think as a patient to have information ahead of time, there are steps that I can take because it's easy to feel like things are not in your control, especially like when you're getting an IUD inserted, to know that they are things that you can certainly do ahead of time. A lot of things, as you mentioned, I think goes a long way in relieving some of the concerns that I mentioned to you earlier. Um, so returning to the concept of hormonal birth control more generally,
Hmm.
as a college student, I'm quite busy, and my classes, they vary. Sometimes they go from 8:30 to 5 p.m. when most doctors' office by that time are closed, and it's difficult to schedule these doctors' appointments around my classes. And so, given these busy circumstances of this period in our lives, where can I most easily get access to hormonal contraception? Should I ask my primary care provider, visit student health, because that's often the most easily accessible option on college campuses, or should I visit a gynecologist? I think that's kind of another question in itself. Is like, do I visit a gynecologist um, to get hormonal birth control, and what role do they play when it comes to um, you know our journey with birth control?
Um, well, Caraway is your easiest way to get hormonal birth control because we are here
Yeah.
24/7. Um, there isn't always a prescriber on at say 3 a.m., but somebody
Okay.
is available at 3 a.m. to talk to you and to get you hooked up with somebody who can prescribe. So um, for a prescription, for a conversation about what kind of birth control is best for you, um, really, I would tell you to go to whoever you're comfortable talking with the most. So if you have a really great relationship with your PCP or your old pediatrician or somebody that you met at your student health center and that's who you want to talk to, then that's who you should talk to. But if you're kind of brand new or you had a negative experience with someone, then I would say, well, Caraway is your best option because we're here 24/7. And we really want to go through a shared decision making process with you to help you determine which method is going to be best for you. And not every method requires an in-person office visit. Obviously, getting an Nexplanon placed in your arm or an IUD placed requires an in-person visit. But if you're interested in the Depo-Provera injection, the pill, the patch, the ring, um, you don't need an in-person exam in order to get a prescription for one of those methods. So we also have access, we can prescribe to mail order pharmacies too, so that if you have trouble getting to an off-campus pharmacy, we can help, help make sure that the prescription gets delivered to you. But really, it's about having the conversation for choosing the method that's going to work best for you. And then how do you access that medication? Well, you got to get the prescription from us. And then, it will get sent to you or you pick it up. Does that answer your question? Okay.
Yes, yes. And I love absolutely that you stress patient comfort first. It's whatever is most comfortable for you. But of course, like you said, I think the 24/7 care model of Caraway is extremely convenient. And the fact that you have access to these certain options without an in-person visit speeds up the process even more. So that's really great. I think it's a lot easier than we might think it is going into the process.
Right, because you don't need an in-person exam for a prescription for birth control pills.
Oh, wow. I actually did not know that. I thought you might have needed a visit before, and then you tell Caraway, "Oh, I've had this visit. Can you just renew my prescription?" I did not know that you could just, get the prescription without an in-person visit. That's really great.
Right. I mean, a personal medical history needs to be taken as part of the visit, be it over the phone, over video, or in person. But a hands-on visit is really only necessary if you're getting a procedural uh, birth control, like Nexplanon or an IUD.
And I know for a fact that Caraway makes that process so much easier through like video calling with providers, as I've done with you before. Yeah, so that's really great that the process can be so streamlined. Um, so for my final question, I wanted to take it sort of more like kind of more of a ethical question, and this can be very much a two-way discussion between the two of us. Um, One thing I find very frustrating is that birth control feels like it's the woman's responsibility always because the woman is the one who can get pregnant, even
Hmm.
though sex is very much a two-way thing. It's
Hmm.
always the woman who has to kind of take this burden on her body in order to avoid a pregnancy. And like I said, our bodies are the ones that have to navigate potentially scary side effects. We are the ones who have to worry about these doctor's appointments, taking the pill, paying for these things, of course, which isn't always cheap. Um, and that can be very burdensome. And I wanted to see what your opinion was about such sentiments and about the fact that you should become sometimes the woman's responsibility, unfairly so, to navigate this journey.
Well, that's a really great conversation to be having. And I share your sentiment, and it's true. It is a woman's burden. Um, the flip side is it's also a woman's extreme privilege to at some point, if she decides to have a baby. But if you're not, if you're 20 something years old and you're in college and you're not even sure if you ever want a family, or you're certain that you do but you don't want to do that now, it's true, the burden really does rest on us.
Yeah.
Um, and you know it's interesting, there is research going on to try and develop a male contraception. There's vasectomy, permanent sterilization. But there isn't, the experimentation and all of the prescriptions for now are for women, and the male contraceptive that's in the pipeline is a topical gel. And what kills me, one of the studies I read about it was that it gets rubbed on the shoulder blade. So I'm like, oh my God, that's like not that easy to get to. I'm like, do they get a back rub when they're getting their contraception put on? I just
Yeah.
feel like, you know, it, anyway, that's a really big question.
Yeah.
Um, I am here just um, so motivated, so dedicated to trying to help young women take control over their bodies as best they can. It is true that every conception is because of two people, and the burden really falls on one of those two. It's an unfair burden, and hopefully what we can do is help you find a contraception that is not only helps protect you from an unplanned pregnancy, but also gives you other benefits too. Like if you are somebody who has painful periods or heavy periods, like that you get some benefit from contraception as well, and not just feel like you're doing this because the the burden rests on your shoulders to help protect yourself. I wish that, you know, some men weren't adverse to wearing a condom. Um, a lot are not, but a lot are. It doesn't feel fair.
I really enjoyed having this conversation with you, Dr. Birenbaum. Is there anything you would like to say to just kind of close us up here?
Um, sure. Thank you for the opportunity to talk with you and answer your questions. I've really loved it. I need to be told to stop because I could really talk about it all day long. It's one of my favorite things to talk about. And I just want to leave you with the message that there are lots of different options out there. And what works for one person may not work for you, but there is likely a method out there that is going to work for you. Hormonal birth control has been around for 50 plus years, and it's done nothing but gotten better and easier to use and safer. There are many more options with varying degrees of concentrations of the certain hormones in them, so that they are better tolerated by people. There's an option for just about any kind of lifestyle, the daily, the weekly, the monthly, the yearly. So there are lots of different options, and it's really okay to put each one through its paces and try one, decide you don't like it, and switch to something else. Because just because one method doesn't work for you doesn't mean that all hormonal contraception is then unavailable to you. You might be surprised at how one simple tweak in maybe the progesterone component makes all the difference. And so one pill may not work for you, but another one does. So I would just encourage you to have a really good heart-to-heart conversation with your provider, and choose a method together, and then know that that method may not be perfect right away, and you can go back and have a conversation, and we can help you make changes to help you find the one that's going to work best for you. They're safe and they're really, really effective. And now more than ever, it's important to take control over your reproductive health.
Well, thank you. I know I've learned so much, and I'm sure everybody listening and watching has too. Thank you.
Thank you.